Hello Ugandans. Hello Ugandans. James William Mugeni. This is my name. I'm a medical clinic officer by profession and a certified public manager. Robert Kabushenga, I knew you before then when you were still in New Vision. Dr. Ekwaro Buku, I knew you when I was still in the struggle for medicine, when I still had a voice for medicine. Faith, Faith, I forget your other name, Nabsha or something like that. Before you had the space today, I was challenging you and telling you that the problem that you doctors, you don't listen. I told you, one, you want to act alone. I told you your strike is inconsequential. Because why is it inconsequential? You allowed yourself to be reduced to that. I told you, Museveni, first and foremost, has discredited doctors, most of you before the patient. So even if you striked, that strike is inconsequential. Then the other thing I was telling you that you have failed to team up with the allied health professionals, the nurses. You're not fighting this battle alone. You're fighting this battle alone. And Dr. Puku, today when you are discussing, you almost discussed the truth. Because most of these doctors, I think I remember Daniel, you remember, I came to inbox and I told you that when I listen to you people discussing, it's like some primary children somewhere. You're so lay. And yet you are the cream of the country. Now the doctors, when you are asked a simple question, what do you think is the problem? And none of you can even be bold enough to say that it is bad politics. The first victim of bad politics is medicine, because the two are related. Actually, medicine is politics, so politics is medicine. You can use politics to better medicine, you can use medicine to better politics. But most of you, when you listen, I listen to you, I'm like, and I'm denied a microphone. All the jobs I've lost in Uganda, the first job I lost in Mulago was because I was talking about expired drugs in the hospital. Linda Nabushai, remember? Linda Nabushai, this is James William again, who was expelled because of talking about expired drugs in Mulago. 1993, long time ago. So today I was listening to doctors and given space, they're so naive. I bought my own microphones because people don't allow me to use their microphones. People deny me microphones. Even the state where I am, it's on record. I'm the only one who has almost pushed a legislation on allowing medics to come from any other part of the country to practice internationally. I wish I can read for you the letter that was written to the president of the Global Association of Clinical Officers. St. James is pushing for medics to practice internationally. Now, the Ugandan doctors, to sort out that problem of interns, when I qualified in 1997, there was a ban on the recruitment of health workers. Some of us just went to West. We went to West. 1997, there was a ban on the recruitment of health workers, and the same thing continues. Now, you doctors, the interns, you are fighting alone. You don't know that there are nurses who have not been interned. You don't know that there are medical clinic officers who have not been interned. And when you are advancing your selfish interests alone as doctors. Where are the nurses who are not interned? Where are the medical clinic officers who are not interned? And you're not speaking about these ones. Then lastly, the poor patients, those poor patients, you people are saying that the poor patients are going to suffer. The poor patients have the vote that has destroyed the country. And most of you work with these patients that you can't talk to them. I told Faith today, Dr. Faith, you are so common on the social media. I told you today that your strike is inconsequential. By the time a Uganda needs a specialist, they need to write their will. Primary health care, where the clinical officers are engaged, treat the Ugandan populations. Don't tell me You want to have a doctor to go and treat jiggers in Busoga, or scabies in Tororo, or latrine coverage. I saw some district without latrines where people go to the bush. By the time a Ugandan needs a doctor, they should be writing their will. One time I was on radio and I said, if there's the only business I want to invest in was coffins, because I know right now when the doctors are striking like this, the nurses have a field day, the clinical officers have a field day. When will you team up as a team to liberate Ugandans? The poor patients that we have in Uganda are not clients, are not customers for the medical system. They are not. You just need all those people off. Medicine is the most expensive item and it must advance. It should be advanced more than the country advances. Because there's no cheap treatment. If it is a heart surgery, it's a heart surgery, which most Ugandans need. If it is a stroke, it's a stroke, which most Ugandans need. So you're not going to say, don't compare us. You need to advance medicine to this level. In the states where we are, every county has a district hospital and as good as Mulago or better. So for us in Uganda, the medics, my dear, I told you are the ones to liberate the country, but you don't know. You don't know. Dr. Book, you almost mentioned it. You're shying away from politics, but medicine is politics. Thank you for listening to James William Mugeni.